Eating disorders is a very unique class of psychological disorders that involve stark presentations of how people relate to food and what that means for their body. The first two eating disorders are similar in that they both have a lot of concern about food, and they engage in activities to try to manage their weight, their body shape. That is different from binge eating disorder, which we will look at in a moment. So anorexia nervosa is the most stark of the two. You can see this girl in the lower left-hand corner. She is extremely skinny, but to her, she doesn't believe that she looks that skinny. And usually anorexia is not diagnosed until it gets very serious, meaning they are severely underweight, that they start to show other problems, such as fainting, loss of your period, other health problems that go with basically starving your body. The criteria are restriction of energy intake, and that means either that usually means eating very little. It can also be exercising a lot to also try to burn a lot of calories. They also have an intense fear of being fat, gaining weight, so it's almost obsession-like in that sense that they believe that they are going to gain weight or they are fat. Finally, they have a disturbance in the way they perceive their body, weight, or shape. And this persists despite the fact that everyone around them sees who they are as very, very skinny. Bulimia, on the other hand, is binge eating. Excessive amounts of food in a very short time, you know, in the area of like 8 to 10,000 calories. It would be like, you know, sitting down and eating 7 pizzas in one sitting, particularly if you were my size, and someone who is not very big. Maybe that wouldn't be difficult if you were a 350-pound male. But you eat a lot, and when you're doing that, you feel completely out of control, almost like you are doing it not in a zombie-like way. Not that you're out of touch with reality, but you feel like you cannot stop it. They have compensatory behavior where they do multiple things to try to prevent themselves from gaining weight. They can vomit. They might use excessive laxatives, diuretics, which are water pills, or other medications, or excessive exercise. So they're trying to use means to prevent themselves from gaining weight. They engage with this binge eating at least one time a week for a 3-month period, as well as the compensatory behavior. When they look at themselves, again, their perception is based excessively on their body image. So some of the patterns of anorexia and bulimia. Anorexia typically develops at a younger age, from 15 to 19-year-olds, so teenagers. It's not very common. It is, though, the disorder that most commonly leads to death, so it is very lethal, more so than any other disorder. These people have a high suicide risk, and it's just a very poor prognosis. In other words, it's very, very difficult to treat people with anorexia. It tends to coexist with depression, obsessive-compulsive disorder, and borderline personality disorder, which we will look at in a future time. Bulimia, in contrast, develops later in life. 30 to 50-year-olds, again, not very common. They typically have excessive medical problems. Now, those with anorexia do too, but oftentimes, by the time those medical problems surface, it often ends up being lethal. So people with bulimia end up having medical problems, but often don't end up dying from those. So heart problems from the electrolyte changing in their body, decaying teeth from eating, from vomiting excessively, and you see other common medical problems there. There is definitely a better prognosis with bulimia. We're better at treating it. But you see some overlap there. It also is comorbid with obsessive compulsive disorder and depression. The final eating disorder then is binge eating disorder, and this was a new diagnosis added to the DSM-5. These are people who, unlike anorexia, are often overweight. I should say with bulimia, by the way, you can be actually at normal weight or overweight. Many times people with bulimia are actually not underweight and maybe could even lose a few pounds. But binge eating disorder often means that a person is overweight and they eat excessively, but they don't do anything to try to lose weight, such as exercising, vomiting, dieting. Their binges are like bulimia. In addition, they eat very rapidly. They eat till they are miserably full. They do not eat when they're physically hungry. They tend to eat in isolation because they are embarrassed, and they feel very disgusted about their body. So they don't, it doesn't bring them a sense of mastery to do this. And many of you perhaps have seen My 600-Pound Life or The Biggest Loser, where you've seen chronicles of people's life who have really been dominated by excessive food intake. Many of them would be probably would meet criteria for binge eating disorder. Looking at other cultures, this has been of interest for quite some time because we know that media, cultural influence is strong in at least being a factor in eating disorders. So there has been some cross-cultural research. For example, in Iran, there are similar rates to the United States. But in the U.S., black women do have lower rates of eating disorders as compared to Caucasian women. In Hong Kong, there is a unique fear of stomach bloating. For some reason, that area of the body is considered very important, and so there can be eating disorders associated with that specific fear. In Ghana, there are, again, eating disorders are often connected with feeling self-control and wanting to deny hunger. So it's a slightly different focus. In Japan, among the Japanese, there's less concern about perfection, which often goes with eating disorders, but there is a real focus on being thin. So again, a cultural revering of thinness. So there are numerous, sorry about that, there are numerous causal factors, risk factors. I'll finish these and then we'll go on. I will create another video. So there are several biological factors. It does seem to have a genetic component. If you have eating disorders in your family, it's you're at an increased risk for it. Set point might have a role to play as well, and that is the idea that we have a biologically kind of determined weight that our bodies try to move toward, and any attempt to move beyond that is very difficult. And so maybe something happens in the set point disruption that is part of eating disorders. Serotonin is also a critical neurotransmitter involved. We know that people with anorexia have lower levels of metabolite of serotonin, and so it's indicating that that is important, especially in anorexia, not so much in bulimia. Sociocultural factors are very important. As you certainly know, different cultures have different ideals of what it means to be beautiful, and those media images are very powerful. In fact, cross-cultural studies have shown that anywhere that Western television has been broadcast, it ends up, the rates of eating disorders go up substantially within a few years. In terms of the family, there are patterns that show families which are rigid and very overly protective, controlling, have a lot of conflict between parents, and really focus on being thin and body image, have children who are higher risk for eating disorders. Within the individual then, no surprise, probably females are at higher risk. Those who believe that a thin figure is to be attained, they've internalized that, are also at risk. Perfectionism as a personality trait, believing that you should always strive to be not just the best, but you should be perfect, is a high risk factor. Poor body image, negative emotions, so anger, frustration, irritability, depression, rumination, all those are often risk factors as well. And then finally, childhood abuse, where there has been, whether that be physical, sexual, or emotional abuse.